Hello and welcome. Happy Doctor's Day to all the viewers watching. I wish everybody a very happy Doctor's Day on behalf of Team Voice of Healthcare and Manipal Hospitals. So, this is the second year we are celebrating Doctor's Day with Manipal Hospitals this year. Today we have Dr. Rohit Kumar, who is the consultant of surgical oncology at Manipal Comprehensive Cancer Center, Manipal Hospital, Old Airport Road, and Sarjapur. Welcome, sir.
Hi,
True,
tell me, please. Go ahead, carry on.
yeah. True service to healthcare relies in treating a patient, not just a disease. That is why Dr. Rohit believes in educating the patients about their disease to empower them to take decisions for their better health and not just to treat diseases. He believes that healing is an inside out process with the support from outside in by the doctor. He works on strengthening the four pillars of health: sleep, food, movement, and mind. So, we would be having a very candid one on one conversation with Dr. Rohit today on many things regarding his experience as doctor for the doctors of the future as well as healthcare. So, my first question to Dr. Rohit is, sir, please share your medical journey and what were the biggest learning lessons and the challenges that you had to overcome that make you the person you are today?
Yes, thank you for the opportunity. It's a pleasure to be speaking on this occasion. And my heartfelt wishes and congratulations to all doctors, to all healthcare healers who are at the front face of serving people. Uh, yeah, to start off my medical journey as such, I am the first doctor in my family of generations of going back to around 2 to 3 generations. So my father was a regular, a person from village who traveled out with dreams to taluk level places, and there, he wanted us to pursue something in our life. So as for any father's dream in India, the only two options for professions it was little either you are an engineer or you're a doctor or you're a failure. So but that is not something what my parents forced us. Actually, he was more like you should get into service in social health care. You have to do something related to in the administrative service or something like that. But my passions since plus two, especially in plus two, was more towards the human biology, understanding of how human relationships happens, how the health goes, all those things. I was more actually interested in dissection. In plus two, in plus one, plus two, we get to dissect cockroach and frogs. Okay, so once I saw that thing, it excited a lot to me. So whenever at my home, way back in my, I was brought up in Bhadravati, it's Taluk place in Karnataka. So there, whenever I used to find some dead cockroaches or dead frogs in my background, in my gardens, I used to just catch hold of it, take my dissection set, and I used to dissect on my own. So that was the beginning of the surgeon, right way back in my plus twos. So that was something which was always there in my mind. And somehow, as I tell, clarity always precedes mastery. So if you have a clarity of thoughts, you'll always go into those things and go and reach out to those things. So somehow I was, it was just intuition or something which was there in me, that I always felt, medicine and surgical, especially surgery, was a little more of attraction to me. The other part is that applying physics was, I was not so good at it. So I felt biology I'll be able to make more justice. So then I did my undergraduate from Vijayanagara Institute of Medical Sciences, Ballari, which is a government college. So then after I finishing my undergrad, I went on to do my masters in general surgery from the reputed Mysore Medical College and Research Institute, under a very good mentors and leaders, teachers who taught us what is the value of care, what is the value of human touch, how people of different society come to us, how we should cater to them, what are the priorities and addressing those things. And after that, I was somehow very much into surgical branches which has a lot of challenges every day, and some of that led for me to take up oncology services to pursue. So I finished my super specialization, that is doctorate of national board in surgical oncology. So I'm trained to be a cancer surgeon. I operate everything except for brain and bone and spine. That's what I tell everybody whenever they ask us. And all the way throughout my journey, I've always had very good mentors. Mentors are the guiding lines for us. It's very important. I was very much blessed to have mentors like Dr. Somshekhar, Dr. Zaveri, Dr. Geeta Avadani, who was head of was head and dean of Mysore Medical Colleges Institute, Dr. Dinesh, Dr. Madhu. There were many people who shaped our clinical outcome what I am today. As a person, as a doctor, as a profession, everything. So that was part of medical journey as such. What are my learning lessons? Uh, my learning lessons, as I told you, main thing is about clarity. All throughout my things, we had plenty of exams to take. So after MBBS, you could either take KSET, you could take COMEDK, you could take All India Entrance, PMT. There are a lot of entrances. So always I was very much sure, okay, I'll be writing only this exam. I'll concentrate on this. I'll study this and I'll go ahead. So this helped me. I don't know, it was just a single intuition or is that a fear of too many rejections. I was just thinking that, okay, I'll write only this exam and I'll do it. So after that, when I went and prepared to my super specialization exams, at that point of time, we had to travel all over India to write exams. To get an oncology seat, there were just around 30 seats in the entire India as such. So we had to go to every different institutions to write exams. But there was the doctorate of national board exam which happened once in a year. So I told I'm not going to travel anywhere. I'm going to write just this exam and I'm going to take this seat. And I took it. So all those times I had a sort of clarity in me which helped me to decide what I needed, what I wanted in life. And my parents, all the way, they were like, I know, we all know that you know what you want in life and you will pursue it. So you go ahead. That was one thing which was very important for me. Apart from that, two or three very important learnings which my mentors have put on me is that you are always your best competitor. Don't compete with anybody else outside. If you're looking at somebody else, you're only going to beat his records. And you have the potential to become a lot more than what he can become. So always compete with yourself. This was my learning. My learning is always about competing myself, how best I can be to my patients, to myself, each and every day, to any person who I come across. That is one of the important learning. The other important learning which my mentor Dr. Somshekhar has put in me is that you are never absolute in a place. Don't ever assume that because of some position wherever you are in, if you leave, that everything will collapse. Or if you're not there, things will not go. It is not like that. There is always another person who can replace you. You are never absolute in a place. That is very much important for us to understand, to have that humility to accept wherever I grow, that I can be replaced by a better person than me at any point of time. And always be willing to learning to become a better person what you were before. And the basic principle for me to work anywhere was that at your job or at work, what you are becoming is more important than what you are getting there. So when I finished off my oncology services, many of my friends, they were like just finished, they went back to government services, just opting, thinking that they will get good security of things. And few people went back to second tier cities to serve people or to understand where the life becomes a lot more easier. You don't have to struggle too much, juggle too much. But my pursuit was to become the best of whatever I could become. I always wanted to excel in things. I wanted to become the best of my out whatever I could be. So I pushed myself to my limits, and I always felt even though if I'm not earning more, earning will eventually follow. That is the second part of it. We're not just bothered. So I was becoming a lot more better clinician, lot more better doctor, lot more better person, a better profession to understand people being here. So, and the quality of service what we give helped us more and more become that person. So to compare, as of I should not compare, but many of my friends who went back telling that they are satisfied with this, and they told they are making good life, they are living good. But I'm not telling I'm not living good. I'm living good. But along with that, what else do I have? Along with that, because of the way I have struggled in this place, or my, I would not tell struggle, because of the passion for the work I've done here, I am in touch with people who are number ones in the world, doing peritoneal surface malignancy, doing high-end surgeries. I talk to them face to face. The research work, what we do at Manipal Comprehensive Cancer Center, they look back to us to ask, okay, you people are doing this, can we take anything back from you? And that gives me more happiness than just earning money. So this is what I would put in nutshell.
Thank you so much, sir. That was so inspiring for, especially for all the future doctors who are watching this channel. I hope they are able to take out the most of what you shared, your experience and your inspiration and your knowledge. With that, we conclude this by the last question for you, which would be, as we are celebrating Doctors Day today, we are celebrating the unsung heroes that keep the nation healthy, and they work tirelessly day in and day out to keep all the people in the world healthy. Please share with the audience top 3 things according to you that are a must to stay healthy.
Okay, it's a very difficult question to answer, but I think I can come up with two, three good ones. So I would back up any statements that we usually make, especially cancer surgeons or oncologists. Whenever they make a sentence, their sentence is always and always backed up by research. So I'm going to give you all research-based answer that is applicable to general life as such. So my first point to anybody who wants to stay healthy is from the longest research study about human happiness that was conducted at Stanford University, which went on for over more than 75 years to know who are the most successful people in life and who are the people who are most happiest in life. And the answer is the people who are able to have a good quality relationship in their life. They are the ones who are happy, who are successful. So invest. The first point I would tell for anybody who wants to stay healthy is your health, your happiness depends upon the quality of relationships that you have around you. So invest in your relationships as much as possible. They are the ones who is going to be with you, who is going to be along you, and who is going to be there after you also. So investing in your relationship is more important for your life. Second point, I would stress upon this for anybody, whoever is there, please prioritize your self care. At this point of time, self care is not selfishness, it is the necessity of life. If you are not happy, if you are not healthy, you cannot take care of anybody else. What do they tell us the moment the flight is being taken off? The moment oxygen drops, hold it on your mask first, not on the one besides you. Because if you are alive, you can take care of the person next to you. So prioritize your health. Take care of yourself. Your health is utmost importance. I know everybody around you is also important, but you can be your best only when your health is taken care of. So please prioritize your health and stabilize the pillars that I have mentioned. They are your sleep, your food, your movements, and your mind. This is the powerhouse of the humanity. This can make us or break us. Last but not the least, one thing I would always tell everybody is that being healthy is the second part of it, but to take care of that health, you have to have health insurance. I tell all my friends, irrespective of you earn 10 rupees, 100 rupees, 1000 rupees, invest in yourself and your family for health insurance first. Without health insurance, whatever your hard earned money, whatever your health is, it will just go into lane. So invest in your health insurances, invest in healthy behaviors for your life, and then have good quality relationships for life.
Very appropriate, very precise, and very informational, sir. Thank you so much. With that, we wrap up this super interesting session with Dr. Rohit Kumar. Sir, thank you so much for taking out your valuable time and sharing all your knowledge and expertise with us and our viewers on this Doctor's Day. I hope the viewers were able to learn so much as myself while hearing you speak. With that, thank you so much. We come to the end.
Thank you all, and take care.
Thank you. For more such information and content, keep watching. Welcome you all on the Happy Doctors Day event with Manipal Hospital, organized by Voice of Healthcare. This is the second year we are doing Doctors Day celebration with Manipal Hospitals. So this year we are doing this day-long event with all the doctors in Manipal. For today's session here, we are doing an exclusive one-on-one talk with Dr. Rajesh Mohan Shetty. He is the lead consultant of Department of Critical Care Medicine and Chief of Clinical Services at Manipal Hospitals Whitefield. He is MBBS, FRCA from UK, FFICM from UK, CCT from UK, FICCM from India, FICCM from Australia and New Zealand, and FRCP from Edinburgh. His field of expertise include extracorporeal life support, critical care sonography, and echocardiography. Also includes advanced cardiac life support, research in the field of quality of life after critical illness, sedation monitoring in ICU, diaphragm protective ventilation, and a lot more. Welcome to the show, sir.
Thank you, Dr. Sawant. Happy Doctor's Day to you as well. And thank you for making me part of this discussion.
The pleasure is all ours, sir. We are so glad to have you. Let us begin. So, my first question to you would be, please, can you share your medical journey and the biggest learning lessons and about something about the challenges that you had to overcome that made you the person that you are today?
Thank you. I was born in a small town in North Karnataka. The town is called Aland, which is about 15 kilometers from Maharashtra. I did my medical education in Government Medical College in Mysore, and then I went to UK, and I worked in UK and Australia. Most of my postgraduate training was there. I worked in some of the best hospitals in London and Sydney, and I'm really happy about the fact that having come from a small background in a small town, I was able to reach and work in some of the best hospitals in London and Sydney. The biggest thing I learned, going to all these different places and working there, is that there is more than one way you can do a thing. And what you need to do is look at the patient as a holistic care. Look not only at the disease you're treating, but the patient's background as well, and even the patient's family and the financial status. All these things are important when you are caring for a patient. And out of the box thinking is very important. If you come across a difficult patient and you feel like nowhere to go, getting involved more people, thinking out of the box will give you solutions many of the time. And innovation and change is the only constant. These are some of the things I learned in my journey going through all these different places.
Thank you so much for sharing all these things with us, sir. I'm sure the viewers are equally excited as I am to learn from your journey. Um, so, moving on to my next query, which is, how are you adopting technology and integrating connected health modalities in your department? Can you please
Uh,
share a little bit
Sure,
about that?
Sure. Thank you, Dr. Sawant. Manipal Hospital Whitefield is the first, digital hospital in the Manipal network. We started this journey for the last few years, and now in the last 6 months, we have increased the adoption, and we are nearly 90% digital, and hopefully very soon we will be completely paperless hospital, apart from government requirement for consent forms and things like that. And what we have seen with digital transformation is communication has improved dramatically, and our efficiency of work has improved as well. And surveillance and monitoring has improved a lot. And on the whole, I feel digitalization should come to all the hospitals in India, including the second tier, third tier cities, even the villages, because in the end it will reduce cost of healthcare and improve the efficiency. And that is the biggest thing I've seen with the digital adaptation.
Thank you, sir. Moving on to the same lines, what, according to you, is the future scope of health technology advancements? What's next to come? What is that next big project that you are working along with Manipal Hospital, or your department is looking forward to? Please share.
I think going forward, you will see further growth. From the technology point of view, the biggest thing I think will happen is automation of things. We have seen robotic surgeries already. I would think that more and more surgeries will be done by robots, and
So I guess there is some network issue. Yeah.
yeah, sorry, there was
Sir,
a
can we
telephone.
have the
Hmm.
No worries. Can we have a little you facing the screen? You are cutting out a little bit.
Okay, so I think,
Yeah, yeah,
is that okay?
yeah.
Sure.
Yes, sir, that is better. Please continue.
So yeah, what I was saying is that the automation is going to be the biggest thing we will see, going forward. We have already seen robotic surgeries, coming into place, and what I see going forward is more and more surgeries will be done as a robotic surgery. The minimally invasive surgery will, take a big leap as well. So as a result, the hospital length of stay will come down, and the patient's outcome will increase as well. The next biggest thing I see is that some of the diseases which were done by surgery, like for example, the gastric surgery was done for gastric ulcers before. Now medicine can treat that. I would see that many more surgeries may not be done needed to be done at all, and maybe medicines will treat them. The other thing I would see is that some of the diseases, which especially long-term diseases like diabetes, where you have to take long-term medicine like insulin, may be completely cured by surgery. So a huge transformation from that point of view as well, it will happen. In the immediate future, what I would see specifically related to Manipal Hospital or India in general is artificial intelligence. We are seeing that vitals monitoring, for example, right now we are doing it manually. Even that will become automated in the near future, and once that happens, lot of data can be streamed digitally, and there will be opportunity to analyze it and predict the future course of the disease using the artificial intelligence, and it will help us to see how the patient is progressing. Especially deteriorating patients can be recognized early, and in that way intervention can be done early, and hopefully treatment can be done early, and outcomes will improve as well. It will help with the diagnosis as well. These are some of the things I think that we will see going forward. One is automation. Next one is artificial intelligence. Another one is some of the things which are done by surgery will move on to medicine, and some of the long-term diseases which are treated by medicine, probably with surgery, the patients may not have to suffer from diabetes for rest of their life. You will have a permanent cure.
Definitely, sir. Hearing you speak about all these things definitely make us very excited for the future. So, moving on, um, my next question would be, what are the top three tips for the future doctors aspiring to be on the healthcare journey? What would your advice be for them?
What I would say that the budding doctors who are doctors of the future is keep your mind open, and keep open mind for the possibilities which exist, and see the patient in a holistic way. Look at patient as not a disease which needs a treatment, as a person who has a long life ahead of him, and how we can make them a complete person, so that they will remain productive for the rest of their life. The next thing what I would advise them is that embrace technology. We have artificial intelligence, we have telemedicine, we have automation. Don't see them as a hindrance. They are here to supplement you, they are here to complete you, and they are here to make you more efficient. So embrace it positively, so that you will benefit from it, and the humankind will benefit from it as well.
Well, I'm sure all our viewers are getting so much wealth of information hearing from
Thanks.
you. The last question to you would be that as we are celebrating Doctors' Day today, we are celebrating the unsung heroes that keep the nation
Mm.
healthy, that work tirelessly towards our health day in and day out. Please share with the audience those three things, according to you, that are a must to stay healthy.
Yeah, I know that the more and more people are looking for more knowledge, and Google is one of the sources where they go. Some of the doctors are not very happy about that. What I would say is that please do read. I think it is important to know about the whatever disease you are going through, and read more. And if you look at overseas, there are societies like Alzheimer's Society and Parkinson's Society. For every disease, there is a society. Please join those societies and read more from there as well. And maybe we should work towards creating such societies in India as well, so that you know more about the disease. You'll be more comfortable, and hopefully it will be more helpful for you as well. The second advice I would give is, please work with the doctor. Don't choose a good doctor, choose a good hospital and a good doctor, and work with them. Have a trust in them, and go with their advice. If both of you and your doctor work as a team, your patient will benefit. So it is very important that you work as a team. The third thing is, follow doctor's advice completely. There is no point to going to a doctor and either not taking the advice at all, or only taking it only halfway. It is important that you take it with the full spirit and follow the complete advice, and continue with the follow up as well, so that you will get the best results for all the efforts that the doctors are putting. And that will be my three
Brilliant,
advices.
sir. Brilliant. That is some brilliant advice in a very short time that we got from you. I
Thank you.
hope the viewers are very, informed about all these things that you shared and are motivated, especially who are aspiring to be the clinicians themselves. Thank you so much for
Thank you,
taking
Dr.
out your
Saha.
valuable time for staying with us. With that, we wrap up this session with Dr. Rajesh Mohan Shetty. Thank you so much. For
Thank you. It's a
more,
pleasure
please
talking to
keep
you.
on watching.
Thank you.
Thank you.
Thanks a lot. Bye bye.
Hello and welcome. I welcome you all to the Doctors' Day celebration where we are celebrating the unsung heroes. So this is the second year we are doing Doctors' Day long celebration with Manipal hospitals. This is organized by Voice of Healthcare. The topic for this discussion is Doctors of the Future, and we have Dr. Rajiv Lochan here with us, who is the lead consultant of HPB and liver transplantation surgeries at Manipal Hospital, Old Airport Road, Bangalore. He is MBBS, MS, MD, FRCS, FRCS HPV, CCT, and has European diploma in transplantation. His field of expertise include liver transplantations, management of pancreatic cancer, hepatocellular cancer, and other forms of malignancy, as well as acute and chronic pancreatitis. He also takes care of pancreatic cancers and is expert in the treatment of HCC, modulation of liver refusion injury following its transplantation. and increasing donor safety in LDLT. So, welcome to the show, sir. We are so glad to have you.
Thank you so much, Dr. Sabri. It's a pleasure to speak to you and to interact with all our audience digitally.
Yes. So, for our audience, we have these questions that we are very curious to know from you. Let me start with the first one. Can you please share your medical journey and the biggest learning lessons? And please share us about the challenges that you had to overcome to be the success that you are today.
I think it's sort of basically I must say that I'm really thankful to all the teachers that I've met during my journey, and also to the numerous patients who have reposed their faith in being treated by me and by our team. I basically grew up in an army cantonment in Coimbatore, where my father was posted at that time. So he was a teacher, and I studied in Kendra Vidyalaya until my 12th standard, and subsequently went into medical school. I did reasonably well. I mean, I was not very sure if I wanted to be a doctor. I'd also got a seat in IIT Bombay, but I just chose medicine. And I did my medical school in Mysore, and then I did my MS in surgery from Bangalore, and then I went off to the UK to study liver surgery. One of the earliest influences on my life has been a person called Professor Shetty, who was a professor of medicine in Mysore, and then subsequently my own Professor Dinesh Babu, who taught me surgery. I'm really grateful to these people. And I met some really wonderful people in the UK who actually shaped my interest in liver surgery and liver transplantation. After 15 years in UK, I spent a year in Hong Kong, in the Queen Mary Hospital, where I met some really pioneering liver transplant surgeons. And subsequently, I came back to India in 2015. And then we've started a liver unit here in Bangalore. So I must say that I've been really proud of the work that we've done here in Karnataka, because before us, there was no liver transplant unit here. We've done about 800 liver transplants here now in Karnataka over the past 7 years, including around about 100 pediatric transplants. And so we have a really successful program here. And, in fact, recently we transplanted one of the smallest children in Karnataka, an 8-month-old child, for a disease called propionic acidemia. And we managed to develop a nice team. I think the biggest advantages, or what I'm really thankful for, is the big team that we have with us. So we wouldn't be able to do all this work without having this environment. And I think in Manipal Hospital, we have the perfect ingredients to develop a world-class liver unit, which we are in the process of doing.
Thank you for sharing the insights, sir. It is so commendable, all the work that you are doing for, health care and treating patients all over. So, moving on to the next question. So, how are you adopting latest technologies and integrating connected health modalities in your department? Please share with us a little bit on that.
Yeah, so you see, I mean, the world is rapidly moving, and especially the recent pandemic has, thrown a lot of new challenges in patient care. And I must say that not only the challenges, it has also made us accepting of newer technologies. Not the technology was there before the pandemic as well, but we as doctors and also patients have learned to accept, that we will have to use the World Wide Web and also the digital technologies that we have at our disposal. And certainly remote monitoring of ill patients, is something that we are doing. We now have our intensivists in Manipal Hospital, Old Airport Road, have the capacity to monitor seriously ill patients in other Manipal hospitals. Let's say we do a transplant in Mangalore or Salem or Vijayawada or some other remote place. Our intensivists are able to keep a watch on them through telemedicine. And, it is just as though our specialist intensivist was over there in that remote location. So we're able to deliver really specialist quaternary care in remote parts of our network, of Manipal network. And that is one of the big advantages. We're able to talk to patients through video consultation, and we have lots and lots of international patients, Manipal being a very well-known healthcare destination all over the world. We have patients coming from the northeast of India, from Africa, and from various other parts of the world, and we're able to continue to see them In fact, recently, just this morning, I was talking to our physicians from Kasturba Hospital, through teleconsult and managing a patient with acute liver failure from there. So this is one really fantastic opportunity that we are exploiting. As far as transplantation is concerned, the big thing in transplantation is actually organ preserving machines. In fact, we are in the process of developing some new such machines, which the in association with the biomedical engineering department at Manipal Institute of Technology at Mahe. Manipal has always been a big education destination, and that's one of the big advantages for us. We're able to collaborate with academicians, in the relevant field. So we're able to, that is one of the big things that we are doing. The other thing that we're going to start in the very near future is actually robotic donor hepatectomies in our unit. So we have the necessary expertise, and we have, a well-functioning robotic surgery department already. And in their collaboration, we are hoping to make donor surgeries, donor liver operations, much more, safer and pain-free for the donors by doing robotic operations, which is going to start in the very near future. So this is some examples of how we are able to use technology to help patients and make the whole experience better and safer for them.
It is definitely so fascinating, sir, to hear you talk about all these new technologies that you are developing, working, and also using currently as well. So, moving on to the next question, there are so many aspiring doctors who would be watching this show today. So, please share top 3 tips for the future doctors who are aspiring to be in the healthcare journey.
I think one of the first things I'd like to tell is what one of my bosses told me. Medicine is all about hard work. I think that's something very, very important. You don't need to be extremely bright or intelligent. I think of course, it helps if you are sharp. But I think more than that, what is needed is actually hard work. I think that's something very, very important. Don't shy away from hard work and continue to work hard, and then the cream will rise to the top. That's what one of my bosses very early told me. I think that's very, very, very important. There are no shortcuts in medicine. You don't have to be a genius, but you have to labor hard. I think that's the first thing. And the second thing is that you should be able to work in a team. I think that's very, very important. You should be able to work in a team. If you're not a team player, you don't need to be a tennis player, but you need to be a football player. You need to learn to work in a team. I think that's very important. And the third and the most important thing is that always think of the best for your patient. I think the patient is at the center of your universe. I think that is the most important thing. Everything else is secondary. I think these 3 things are what I'd like to say. And these 3 things are certainly the things that I follow in my day-to-day professional practice. And everybody in our team focuses on these 3 things. And I think it's very important for the future doctors to actually, keep this at sort of foremost in their mind.
Definitely, sir. Very wisely shared. So we come down to the very last question for the session. As we are celebrating Doctors' Day today, we are celebrating the unsung heroes that keep the nation healthy, that work tirelessly for day in and day out for the health of the citizens of this country. So please share with the audience those top 3 things according to you that are a must to stay healthy for everybody.
I think the most important thing is to be positive, is to be happy. I think that is the most important thing, be cheerful, be happy, say hello to everybody that you meet on the way, don't hold any grudges against anybody. That'll keep you happy. I think that's sort of most important. Second thing is, exercise. That's very important. Number 3, don't indulge too much in anything. I think be moderate in everything. I think that's very, very important. I think if you're happy and spread happiness around, exercise a bit, and don't be too greedy about anything. I think that's more than enough to keep, to keep you going until you're more than 100. I think.
Thank you so much, sir. With that, we wrap up this super interesting session with Dr. Rajiv Lochan. For more such interesting conversations, please keep watching. I wish you all a very happy Doctor's Day and stay blessed. Thank you.
Thank you, Dr. Sabri.
and welcome everybody. I welcome you all to the Doctors' Day panel discussion when we are celebrating the unsung heroes organized by Voice of Healthcare in association with Manipal Hospitals. So, this is the second year we are celebrating Doctors' Day with Manipal Hospitals. This year as well, we are doing a day-long event with all the eminent doctors from Manipal hospitals. And for this session, we have a very eminent doctor with us today, Dr. Mukundan Sheshadri, who is the consultant of cardiothoracic vascular surgery at Manipal Hospitals, Whitefield. He is an MBBS, MS, and MCH, and DNB, and his field of expertise is cardiovascular surgery and thoracic surgery. We welcome you to the show, sir.
Hi.
Thank you so much for joining us. Now, let us start with this exclusive one-on-one talk with you. With that, my first question for you would be, can you please share your medical journey and how your journey into medicine began? And what were the biggest learnings and the biggest challenges that you had to face to reach at this point and be a success? Sir, please.
So my medical journey started quite a long time ago. And it actually started with a spark when we had a congenital heart surgeon, a surgeon who was specializing in operating on small babies who had come to India and to do heart surgery in Mumbai a long time ago. And that was the sort of inspiration for all of us to get into heart surgery, to understand that we can actually cure and improve the lives of so many of our people. And so that gave me a spark of enthusiasm and the interest in to get into medicine and specialize into cardiac surgery. Cardiac surgery was really in an infancy in those days, about 25 years ago, where things were actually were not very sophisticated, and it looked like a specialty which was absolutely exciting. It also challenging, and the best part of it was that we could actually achieve a lot of good results and cure the patients, unlike some other specialities. So when you are, as a young surgeon, as a young doctor, when you are always looking at what should you do in the future, this opened up a fantastic window for me, and it gave me a lot of inspiration and hope that we could do something which would be path-breaking and which would actually improve the lives of many people. So that's how it started. It started actually in a place called Pune, which is near Mumbai, and where I did my initial education with MBBS and MS, and then subsequently moved to the prestigious Christian Medical College Hospital in Vellore, which was probably the best center in India those days for getting heart surgery training. Heart surgery was really had really started in India only in Vellore, and also in Delhi and in Chennai. But Vellore was considered the Mecca for heart surgery, and so that's where we headed. And I got myself trained. Subsequently went abroad to the Royal College in England and also in New Zealand, got my skills, fine-tuned, and came back to India. And the question often asked by people is, why did you come back? We came back because cardiac surgery was really still it's in infancy, a specialty which we knew which would save lives, which would help lots of people, which has its challenges, and it was very, very, very exciting, and at the same time gave a lot of satisfaction.
Definitely, sir. As you rightly mentioned, what doctors work for day in and day out is the patient satisfaction. Getting to help is the number one reason that anybody chooses this field for sure. And we would also like to know that with the latest emerging technology into field of cardiothoracic and vascular surgery, how are you adopting such technologies and integrating connected health modalities in your department and in your field?
This is the age of technology, and it's very simple. Those who, imbibe these newer technologies will succeed. Those who do not will go by the wayside. That's very simple logic. And as it is also in, as the same is also in heart surgery. Those who are adopting newer technologies and who are able to adopt newer techniques are the ones who will succeed in the future. The reasons are simple. I think in this world where everything is technology based, people are looking for solutions which give them, less pain, a better cosmetic result, a quicker recovery, and better success rate. All this can be achieved with technology. And the technology we are using in heart surgery is a minimally invasive surgery. So we are, especially here in Manipal Hospital, Whitefield, we have adopted a lot of minimally invasive or minimal access surgery, which we see basically it means using technology to do the surgery with smaller incisions, cosmetic incisions, less pain, faster recovery, and using technological tools to achieve this. So whether it's valvular heart surgery, whether it's a coronary bypass surgery, or whether it's a thoracic surgery, we are doing almost all of this using minimally invasive techniques wherever it's feasible. Of course, we have limitations in our country where you have patients with extensive diffuse disease and diabetics, where it sometimes is foolish to try and do things which are minimally invasive. So you have to be careful and use the right tools. See, technology is there to help you provided you understand the technology. You must use the technology to your benefit and not become a slave of the technology. Use it to your benefit maximally. And I see that, things are moving forward quite rapidly. We are talking of those early days where, I was the first person to do beating heart surgery in Chennai, in India. In fact, South India is the first person. And very early on, when people were still grappling with doing surgery on a heart lung machine, we learned how to do using technology because of my training in England to do it with the heart beating without stopping the heart. So that was the earliest use of technology. And as things progressed, it became better and better. And we started learning how to do coronary artery surgery through small incisions using better technology approach, or even valvular heart surgery. So I think we have adopted technologies and used these to our advantage, but also the follow-up is being done using technology to help us remotely monitor and treat these patients without them having to come into hospital.
Thank you so much for sharing that, sir. As you were speaking, I could definitely see the years worth of sharing with us today. And that is very fascinating to hear your journey and how, it started and what inspired you. On that same note, we have many viewers with us who aspire to be in healthcare themselves, who aspire to be clinicians or in different allied health facilities. So, what would be your three tips for the future doctors or future people aspiring to be on the healthcare journey?
So I think the first tip is be passionate about what you do. If you want to be a doctor, you should only be a doctor if you're really passionate about the subject, about the specialty, and that you must have that hunger in you to want to learn more and more and more, and also to try and excel in what you do. So that is the first tip I say: be passionate. If you're not passionate, this is not the area to be in. The second is empathy. I think that's very important, that in these days of fast-paced world with technology and with all the action going on this front, we tend to forget that at the end of the day, you need empathy. You need to be able to be understand the hearts and the minds and the sympathy of the patient. If you do not have empathy, if you do not have love and care for your patient, whatever good you do in terms of your brilliance in technology, you will never get a good result, because at the end of the day, what heals is not just your work, your surgery, it also the care you give, because that care translates into better treatment, into better technology, into better use of the technology. Because unless you have the care, you will not be able to apply what you have learned in your newer techniques for the patient. So it really boils down, because people often ask, well, I'm doing a perfect job, so if I don't show a little empathy, how does it matter? It does matter, because only when you use your empathy, when you use that, would you be able to apply the latest technology, skills, knowledge, etc., to get a good result. The third, I would say, stay abreast of knowledge. Not only in your field, have a 360-degree view. Look all around, other specialities, outside of medicine. See, the best success comes when people use not only their own subject, but use the knowledge in other subjects of maybe physics, of maybe, advances in space technology, and use that for the benefit of that. We have always the example of a doctor called Gaitonde, who gave us a thing called checklist. He said, one of the ways to get success in heart surgery is to look at the pilots and see how they have used something called a checklist. So when you tick off all the boxes and you make sure you get success today, my advice is that once we have achieved success in getting high-end and excellent results in surgery, we must also achieve good results in percentage numbers and achieve the same standards as what they're achieving in the West. Unless we can get a very high standard using things like checklist, using SOPs, standard of care, and unless we adopt all that, we will not be able to reach the highest standards. We can get very good results in small percentages, but if you want across the specialty, across the board, wide-ranging standard of care, then you need to adopt all that.
Brilliantly explained, sir. Brilliantly. It is so nice to have, hear you speak on all various different topics. We can just go on for a long time and just have your thoughts on different topics altogether. Maybe for the next session, for sure, we'll have you for a longer period of time. But as we're running short, I would proceed on to the last question for you today. As we are celebrating the Doctors' Day, we are celebrating the unsung heroes that keep the nation healthy, that work tirelessly day in and day out for the health of the entire world. Please share with the audience, according to you, those three things that are a must to stay healthy.
I think it's brilliant that you have brought this. It has been brought to our forefront when we had high-profile people dying, who are young people in this state, in this country. Recently, we even had a singer die, we've had an actor die, and we've had a very senior cricketer have angioplasty. So we have to realize that we are all prone and at risk for getting heart disease. And I think that we have to look, as doctors, we have to take care of ourselves. And Manipal has already started that. And, all the doctors above the age of 40 have to start doing a regular testing on a yearly basis. So I think it's the most important that if you're above the age of 40, get yourself a complete cardiac checkup, which must include a lipid profile, a thyroid function, check your sugars, HbA1c, get an ECG, echo, and a treadmill test. Now, these are the bare essential. I think everybody must have this done once at the age of 40. And after that, based on whether you have any other risk factors among these, lipid profile or sugars, etc., you may need to have frequent tests done, or maybe once in 2 or 3 years. But if everything is normal, then once in 4 or 5 years, you can again go through all these tests. But I would suggest a blood test yearly especially looking at your HbA1c, your sugar, looking at your lipid profile is very, very important. The second thing is exercise. I think it is absolutely essential that, especially for doctors in a high strung specialty, you need to exercise. And I myself spend about an hour daily on exercise. I play badminton about 5 days a week. I do a bit of running and I do a bit of cycling the other days, and I do a little bit of weights. So it's important to do a good amount of exercise, preferably about 45 minutes to 1 hour every day, a bit of aerobic, a bit of strength training, maybe a bit of yoga. And you have to lead by example. Look at our Prime Minister. Our Prime Minister is in the forefront of telling people to do yoga in the whole world, and he led the nation on International Yoga Day on the 21st. We as doctors have to lead by example, and we have to show the patient that we are as fit as we want them to be. The third and the last tip I would say is diet. There is absolutely no doubt that the diet is the most important part, and we as doctors must also have the best diet possible. Our diet in general tends to be high carbohydrate diet, so we need to push that down. We need to start using our own ancient grains which are grown in this country, and we say the millets. And in fact, next year is going to be the International Year of the Millets. Let us start now. Let us start using millets more and more in our everyday diet. Let us try to reduce the carbs. Let us try to increase the proteins, have healthy fats. And in that way, I would suggest that one single take-home message is stop eating white rice and use millets, foxtail millet. If you have to take a message of one word, I would say the answer is foxtail millet. You use that on a daily basis, at least 5 days a week, and take out the white rice from your diet. There is no doubt in my mind, and I've seen that in hundreds of patients ever since I started this in about 8 years ago with my patients. I have actually found that I'm able to control diabetes, and in some cases even reverse your diabetes for people who are very, very, very careful. But that is a little difficult to reverse, but at least we can keep it under control. And for those who are non-diabetic or who are pre-diabetic, we can actually prevent it from happening. Because the start is diabetes, it leads to heart disease. We know that metabolic syndrome, what we call, is the commonest cause of heart disease. It starts with basically being, in your middle age, you put on weight, you get obesity that leads to, you get diabetes, hypertension, and eventually you get hyperlipidemia, and finally heart disease. It's a vicious cycle. You want to break the cycle? Get onto your diet, get onto your exercise, try to do a bit of yoga and meditation, and keep your brain active always with 360-degree view of the subject, of the world, of different subjects, and try to keep as active as possible. That would achieve success. And be a role model for your patient. Don't let your patient come and tell you, "Doctor, why are you telling me to be fit? And look at you, you're so unfit." You should never allow that. You should be fitter than your patients. You should be absolutely setting the example for them.
Definitely, sir. Very comprehensive and very inspiring. As I said, we could go on hearing you for hours, not feel, bored. Maybe we can have you again on the show and have an exclusive session again for a longer time. With
Sure.
that,
It will be a
we
pleasure.
thank, yeah. With that, we wrap up this very interesting session with Dr. Mukundan Sheshadri. Sir, thank you so much for taking out your valuable time and sharing all the wealth of knowledge with our viewers today. And with
Thank you.
that, we also come to the end of this day-long session and event with Manipal Hospitals. I hope our live viewers were able to grasp as much information from such eminent panelists throughout the day as possible. And on that note, I wish everybody a happy World Doctors Day as well. Thank you so much, and I wish you have a nice day. Thank you.
Thank you, doctor. Thank you very much for that opportunity.